are 2 weeks into the new year, and many people set the goal every January to work out more.
But hitting the gym can lead to injuries if you don't take the necessary steps to get warmed up. So joining us to talk more about this, we have Dr. Mahi Trivellas, orthopedic surgeon with Sharp Memorial Hospital. And so, well, we want to thank you for being here, first of all.
Absolutely, it's my pleasure. Thank you for having me.
Yes, you have to tell us, what are some of the most common injuries that you guys see during the month of January?
That's a good thought, because obviously January people are getting back to the gym, and so yeah, they're a little bit different injuries, but it's oftentimes just the overuse injuries. Now, if that's a chronic injury, somebody who's been doing the same thing over and over again, or somebody who maybe thought they were getting back to their normal level, but they had taken too much time off, and then they're kind of, again, just overtaxing their bodies. And so it's usually like the tendonitis, the overuse injuries that we see most commonly at that time.
So what are some of those common ways that people get hurt at the gym or at home, like me when I fell off my treadmill after?
I know.
It's like knee injuries? Is that what you usually get?
It's totally variable, obviously, on whatever activity you're doing. So in the gym, a lot of it is either treadmill falls, injuries to your knees, but then even like lifters, weightlifters, you're going to see some impingement in the shoulder. Even there's like a weightlifter's shoulder where you have osteolysis of the AC joint. And it, of course, if it's a traumatic fall or something, then you'll most commonly see labral tears. So if your shoulder shifts out of place or your hip, you know, if you do a high flexion maneuver, you'll tear the labrum that way.
That sounds painful.
Yeah. Just the terminology sounds painful.
Right. Well, so then what's your advice to folks as they get back into the groove of things and, you know, like a proper warm-up, maybe a stretch? What do you suggest?
Yeah, absolutely. So obviously, we kind of mentioned that they'd been taking some time off, and so just ramping up slowly and being really mindful of the activity that you're doing. You know, your body thinks, oh, I'm just going to do what I always do, but if you haven't prepared to, you know, get back at that same level, you're running the risk of hurting yourself. And so I like to tell all my patients, in fact, I've been telling them a lot this week, to slowly increase. And we say about 20% is a safe number because, you know, 20% per week. Obviously, if you're working out every single day, then you can ramp up a little more quickly, but that gives your body enough time to get used to that activity level and then kind of slowly build. And that's also predicated on the fact that you have appropriate rest to recover after your workout.
What about people who really work out a lot and they're doing it right now? Are they more prone to get an injury, perhaps?
Again, it depends. Yes, you know, your classic gym rat or marathon runner, they're also prone to overuse chronic stress injuries. And so they can definitely have the same injuries, but maybe their body is a little bit more in tune with how to do the things that they're doing at the gym, so it might take a little more reps to injure themselves. But yes, they also have to be very mindful.
How do we know? Maybe this is a dumb question.
No.
How do we know if it's a minor injury versus you need to go see a doctor? Because some of us, I feel like we like to put on a really strong face and we're like, oh, like that hurt, but I'm going to tough it out. When do we know?
Great question. Obviously, everyone's different in how well they know their bodies. So people that have worked out before, they know what's just a minor tweak or sprain versus something that's acute and serious. And so I always say, you know, give it 24 hours rest. If it swells up, that's probably not a great sign. If you're like, okay, let me still feel it out, then take a couple days, take anti-inflammatories. You know, I don't love to say take certain types of medications, but anti-inflammatories will calm down the acute injury, the acute inflammation. After a couple days of rest, mindful activity, and then anti-inflammatories, if it doesn't get better, then it's time to see a doctor.
I haven't needed to see any doctors yet, so we're going to keep we're going to stay on that trend, okay?
I probably should have when I fell off, but I'm trying to put on a tough face, okay?
Phil,
all right, there we go.
Phil.
Dr. Trivellas, thank you so much for being with us today.
Absolutely, thank you.